I am an injector here at Therapy Clinic, and I will be talking to you about some frequently asked questions about Botox. Here at Therapy Clinic, all our injectors try and make every treatment as comfortable as possible. We use the smallest needles possible, these very small ones here, and we deliver a very small volume of product underneath the skin into the muscle. It's largely painless, however sometimes there is a very sharp and immediate pinch which does disappear within 1 to 2 seconds. Botox is a naturally purified protein and it is injected directly into muscle to relax it. It is manufactured here in Ireland and it is shipped out all over the world. There's a clinical history behind it of about 40 years, so it's the most researched drug on the market. And for cosmetic purposes, it's used for the last 20 years. And they promise a result which is rejuvenating and refreshing, particularly around the eyes. The side effects of Botox, because it's been researched for so long, are very minimal and it has an incredibly strong safety profile behind it. The most common side effects come hand in hand with the use of a small needle under the skin. So for example, a small amount of bleeding, a little bit of redness, and a little bit of swelling, and they tend to resolve within about 20 to 30 minutes after injection. Another common side effect is bruising. Bruising may not happen every time. It happens in areas which are more vascularized, and it also depends on the patient's skin type, their anatomy, and also any medications that they may be on. So Botox doesn't start working straight away. It kicks in and starts to relax the muscle in about 1 to 2 days, and you see some results within 7 days. However, the best results will be seen in about 2 to 3 weeks after injection. It's strategically placed by your injectors into the muscles to achieve that rejuvenated, refreshed look. Most fine lines and wrinkles will disappear with the use of Botox. However, more etched in lines and people with deeper lines will require more treatment. So they may require treatment every 3 to 4 months over the course of a year to a year and a half to achieve that fresh face look, and also to completely eradicate those lines. Botox actually doesn't give you the frozen look. It acts very locally, so when it's in the muscle, it only affects that part of the muscle it's injected into. So there's still some residual muscle action and still some movement. However, some people do favour that look, but that can also be over treatment. And if that does happen, it's nothing to worry about. Botox will wear away, and it will wear away over the course of 3 months. So anything that does happen will be completely reversible. It certainly can. So Botox relaxes muscle, so it stops it or prevents it from forming those wrinkles. Also, finer wrinkles will disappear with the use of Botox over time. More etched in lines will require a little bit more treatment, however. So some patients with static lines will require treatment every 3 to 4 months for the course of maybe a year to a year and a half to soften or even erase those lines.